A new study on Medicare-for-all conducted by George Mason University's Mercatus Center, which was presumably supposed to initially be a hit piece on Medicare-for-all, ended up inadvertently proving our point for us. So according to Addie Barrett of Think Progress, a single-payer Medicare-for-all system would reduce the amount the U.S. spends on healthcare by more than $2 trillion, a Koch brothers-funded study released Monday found. Research by the Mercatus Center at George Mason University, a libertarian think tank backed by the Koch brothers, projected that the Medicare-for-all plan, championed by Senator Bernie Sanders, would cost the government $32.6 trillion over 10 years. The highly critical report found that even doubling all federal, individual, and corporate income taxes would not cover the costs of Sanders' Medicare-for-all plan. The study did conclude, however, that Medicare-for-all would result in significant savings for the government because of lower prescription drug costs, saving $846 billion over the next decade. Streamlined administrative costs under the plan would save another $1.6 trillion, the researchers at the Mercatus Center found. When we talk about a Medicare-for-all system, it's important to discuss the costs in the context of what the U.S. already spends on healthcare. As of 2016, national health expenditures, which includes federal spending, state Medicaid programs, and private employer healthcare spending, totaled $3.3 trillion per year, according to the Centers for Medicare and Medicaid Services. That means that over the next decade, the U.S. is projected to spend more than $33 trillion plus inflation on healthcare services without any changes to our current healthcare system, significantly more than Mercatus's estimated $32.6 trillion cost to the federal government over the next 10 years. That was certainly an unexpected consequence of a Koch-funded study. Now, the way that conservatives have been trying to spin the results of this study is to really emphasize that cost of $32.6 trillion. So, they've been screaming, Bernie Sanders' Medicare-for-all plan is going to cost $32.6 trillion. But what are they leaving out? Well, our current healthcare system will actually cost more over the next decade. Our current plan, if everything stays the same, will end up costing $33 trillion. So going to Medicare for all, therefore, will save America money, billions of dollars per year, in fact. So this is great. I mean, when the Koch brothers end up doing something that inadvertently ends up making our argument for us, you know that we are on the right track, and right-wingers, they're going to have to scramble if they truly want to compete with our ideas, because not only is Medicare for all now supported by more than 60% of Americans, but now studies are concluding that, yeah, you know what? We actually can pay for Medicare for all. It's a great time to be a progressive. Now, since the Koch brothers are in part responsible for funding this study, they certainly donate a lot of money, but not all of it. But I mean, for the most part, they were behind this study, which, again, was probably supposed to be a hit piece on Medicare for all. But Bernie Sanders decided to come out and troll them by publicly thanking the Koch brothers for funding this particular study. So here's what he said.
Let me thank the Koch brothers, of all people, for sponsoring a study that shows that Medicare for all would save the American people $2 trillion over a 10-year period. I suspect that is not what the Koch brothers intended to do, but that is what is in the study of the Mercatus Center, an organization that is significantly funded by the Koch brothers. At a time when the United States spends far more per capita on healthcare than any other country on earth, almost 18% of our GDP. A Medicare for all healthcare system would save the average family significant sums of money. It will do that by substantially reducing the administrative costs now taking place as a result of the billing, bureaucracy, and insatiable greed within the insurance industry, whose main function in life is not to make people well, but to make stockholders incredibly rich. If we can get rid of the profiteering, the dysfunction, and the incredible waste within the current healthcare system, if we get rid of the advertising and the high-priced compensation packages of healthcare executives, we can save hundreds of billions of dollars each and every year. Medicare for All will also significantly reduce the rapidly escalating cost of prescription drugs. Depending on income, an individual may pay a little bit more in taxes to finance Medicare for All, but they will save thousands of dollars each and every year because they will no longer be paying premiums, deductibles, or co-payments to the private for-profit companies that now run our healthcare system. Today, under our current dysfunctional healthcare system, believe it or not, it costs more than $28,000 a year to provide health care to the typical family of four. Those costs will go down, not up, under a Medicare for All system. Here is the bottom line. If every major country on earth can guarantee health care to all and achieve better health care outcomes while spending substantially less per capita than we do, please do not tell me that the United States of America cannot do the same. Needless to say, there is huge opposition to this legislation from the powerful special interests that profit from the current wasteful healthcare system we have today. The insurance companies, the drug companies, Wall Street, and the Koch brothers are devoting a lot of money to lobbying, campaign contributions, and television ads to defeat this proposal. But they are on the wrong side of history. Guaranteeing health care as a right is important to the American people, not just from a moral and financial perspective. It also happens to be what the majority of the American people want. In the last poll that I saw, 63% of Americans now support moving to a Medicare for All system. The time is long overdue for the United States to join every other industrialized country and guarantee health care to all in a cost-effective manner. And that is what Medicare for All is about.
So that was great. That was very informative. I think that Bernie Sanders is the only person in the history of human existence that's able to troll someone while still sticking to policy substance. That's a really unique talent there. So look, what he's saying is it's correct. And more, I think that we're going to start to see more more conservatives rather, come on board with Medicare for All. There's really no argument that is logical, that's based in reality and empiricism, that is going to back up the argument against Medicare for All. Individuals who aren't on board with Medicare for All, it's just politicians, for the most part, who are taking money from health insurance companies. And if they back Medicare for All, then that existentially threatens health insurance companies. And as a result, that would hurt their chances of getting reelected because they're going to lose out on thousands of dollars from these companies who contribute to their campaigns. So regardless, Medicare for All is the morally right thing to do. And as we continue to hear people like Joe Scarborough make this hacky argument against, we can't possibly pay for it, Medicare, Medicaid, these are programs that are fiscally unsustainable. I think as progressives, we all need to come together and form some sort of cohesive response. And certainly I'm going to put my foot forward in trying to do that. I'm going to bring on someone pretty soon to the show who's going to explain, it's clear as day, how we pay for Medicare for All. Because look, we know we have the right moral argument, and now certainly we have even more evidence that fiscally our argument for Medicare for All is more sound. But we need to basically take that argument and make it more marketable, because this is something that's very complex and convoluted, and it's difficult for ordinary political observers to grasp. So we need to formulate some sort of argument that makes sense to people in terms of paying for Medicare for All. So I'm going to try to do that, and I'm going to continue to push these types of studies that prove our point for us. I mean, I'm a little bit reluctant. I haven't dived into the details of this particular study, but I linked to it in the description. If you want to do that, I'd certainly encourage you to do so. But other studies from more trusted sources like the Kaiser Family Foundation, I would probably feel more comfortable promoting those studies, since we know that their intentions are more pure and they're really striving for objectivity. But with this study, be a little bit skeptical, because again, it's intended to prove their point for them that Medicare for All is bad. But I mean, objectively, they just couldn't do it. So look, at the end of the day, this is good news. I guess I'll I'll expand off of Bernie Sanders here, and I will thank the Koch brothers for once for doing something that wasn't necessarily intended to be good or done for altruistic reasons, but for doing something that backfired horrifically against them.
Support this podcast by becoming a patron at patreon.com/Humanist Report.